Hello everyone. This is Sunaina Ghosh, a student of 4th professional year of Lakhimpur College of Veterinary Science. I am going to present on the topic Pullorum Disease. The contents of my topic are Introduction, where we will look into etiology, distribution and susceptible host, followed by transmission, pathogenesis, clinical findings, lesions and diagnosis, and finally, treatment and prevention. Introduction. Pullorum disease is also known as bacillary white diarrhea and baby chick disease. It is an acute systemic infectious disease of chicks and chronic in form in adult birds. This is characterized by very high mortality in young chickens and turkeys. Etiology. Pullorum disease is caused by gram-negative bacteria Salmonella pullorum. Distribution. The disease has been reported from almost all the states of our country. Susceptible host. Chickens are usually affected, but sometimes turkey and ducks may contact the infection. Guinea fowl, pheasants, quail, sparrows, canaries, European bullfinches, hawk-headed parrots may be naturally infected from exposure with domestic and wild birds. Some mammals like rabbit, guinea pig, chinchillas, pigs, kitten, fox, dog, wild rats, calf, chimpanzee may contact the infection naturally or through experimental method. Mode of transmission. The infection spreads in two ways, through vertical transmission and horizontal transmission. Vertical transmission takes place through infected eggs. Extensive dissemination of infection may occur during hatching from infected embryos to uninfected chicks. Horizontal transmission takes place through contaminated utensils, contaminated feed and water, disease pullets, dead embryos, dead chicks, infected eggs, cannibalism of infected birds, egg eating, visitors, rodents, and flies. Pathogenesis. Pullorum disease produces severe pathogenic effect in chicks within the first 2 to 3 weeks of age. Birds above 3 weeks of age are fairly resistant due to increased blood lymphocytes and increased body temperature. Adult birds do not show any clinical manifestation and remain as carrier. Some breeds are more susceptible to infection over other breeds. Healthy birds are more prone to infection. A sizable proportion of eggs laid by hen contain the organism as a contamination following ovulation. Birds hatched from infected eggs become dead within the incubator or within few minutes after hatching. Now let us see that what are the clinical signs. Signs that are predominantly seen in chicks are white diarrhea, pasting around vent, somnolence, huddling together, and ruffled feathers. These signs in chicks are variable and typical in nature. In incubator, birds look moribund in appearance, that in a continuous manner for a month or so due to infected incubator. Mortality rate may range from 20 to 80%. Death usually occurs in second to third week of age. Respiratory distress, that is gasping, occurs due to changes in the lungs. Ruffled feathers and dropping to wings, drowsiness, weakness and loss of appetite, huddling together and disinclination to move. Excretion of whitish feces, which are chalky white in color. There is pasting of feathers in the vent region, occasional brown colored droppings, occasional blindness and increased thirst, swelled pot-bellied abdomen, continuous peculiar chirping sound and a shrill cry while voiding droppings, lameness, swelling of hock and tibiotarsal joints. Survival turns to asymptomatic carrier. In adults, they do not exhibit any appreciable signs, but variable degrees of reduction of egg laying can be seen. reduction in fertility and hatchability. They may show inaptitude, depression, ruffled feathers, and greenish brown diarrhea. There is dropping of wings and heads, dullness and paleness of comb. That, if any, it may occur due to severe dehydration. Lesions. There is congestion and enlargement of liver. Normal yellow color may be streaked with hemorrhage. Lungs are congested and they show a picture of hemorrhagic pneumonia. Heart gets misshapen. There is necrotic foci and grey nodules. Grey, whitish nodules of various sizes can be found in gizzard. There is white mottling and enlarged spleen. Diagnosis. The diagnosis can be made based on the following criteria: history of mortality, reduction in egg production, clinical signs and characteristic lesions, isolation and identification of Salmonella pullorum from liver and intestine, rapid plate agglutination test. These tests can be made even in the field condition. Colored antigen is available in the market which contains suspension of Salmonella pullorum organism in 1% formal saline and stained. This antigen is used for detection of Salmonella positive carrier and control of outbreak by rapid diagnosis. Besides, intradermal test and FAT can be used. Treatment. Drugs like sulfonamide, chlorotetracycline, furazolidine, and furaltadone can be used for treatment. Some of the furazolidine preparations come under the brand name Furalin, Scorit, Vaxfuran. Besides, trimethoprim sulfadizine or trimethoprim sulfamethoxazole preparations can be used. Entrema powder, sulcoprim powder are some of the trimethoprim sulfadizine preparations. Methaprim powder, odiprim powder are the examples of trimethoprim sulfamethoxazole preparations. Control. These are some of the points which can be followed to prevent the outbreak of Pullorum disease in the farm. Maintain proper hygienic precautions in the farm. Adopt rapid agglutination test as a routine measure. Test all breeding stock with whole blood agglutination test annually or on periodical interval. Reactor birds should be culled and slaughtered immediately. The reactor's percentage, if exceed more than 10%, the whole flock should be culled. Premises should be disinfected with 3% cresol or commercially available disinfectants. Birds should be purchased from Pullorum-free flock. New birds should not be allowed to enter the farm without testing. Infected eggs should not be incubated for hatching. The movements of the birds should be restricted within the farm. Pigs may act as a carrier, thus be kept away from poultry farm. Incubators should be fumigated with formalin and potassium permanganate. Incubator waste should be destroyed by burning. No commercial vaccine is available, hence control measures are of utmost importance. These were the sources of the presentation. With this I conclude the video. Thank you.